Next, we have Dr. SWAROOP KS, who will be talking on knowledge, attitude, and practice patterns regarding medical legal aspects among cataract surgery patients.
In so many, about 20 brothers there, he is the first boy. Welcome, man.
Thank you, sir.
One boy, one boy.
So good morning all. The topic for my paper is knowledge, attitude and practice pattern regarding medical legal aspects among cataract surgery patients. These are my contents. As we all know, medical legal aspects have gained significant attention in the last few years. There have been about 5.2 million cases of medical error filed in India every year, and the number has increased by around 400% in the last decade. But the knowledge, attitude and practice regarding this topic remain poorly understood, and cataract surgeries are often advised as no pain, no stitch procedures that can be performed on a daycare basis with immediate vision gain. This increases patients' expectations regarding the outcome, making ophthalmologists more vulnerable to such litigations. So my objective was to estimate the knowledge, attitude and practice pattern regarding medical legal aspects among cataract surgery patients. And it was a hospital-based descriptive study conducted among patients posted for cataract surgery. We did it among 52 patients after obtaining their informed written consent. The patient demographics and information about prior history of surgery was collected, and the questionnaire had 3 parts. As you can see, it had the knowledge, attitude and practice with 5 questions each. Knowledge was based on the prior knowledge the patient had regarding the importance and need for informed consent and other medical legal aspects. Attitude was regarding the attitude towards the need for knowing about the treatment and complications, and other aspects like patient's rights, responsibilities, and responsible behavior towards health workers. Practice was based on what the patient had done regarding consent, patient's rights and responsibilities following his or her admission in our department, and scores were given based on their responses, and they were classified as having poor, average and good knowledge, attitude and practice. Statistical analysis was conducted using the SPSS software, and these were the results. As you can see, the mean age was 66.9 plus or minus 9.4 years, and majority of them, that is 65% of them, were females. 83% were below the poverty level, and 52% had prior history of surgery. In the education levels, we can see majority of them, that is around 60%, had finished their primary education and only 8% were illiterate. Now coming to the knowledge patterns, good knowledge pattern was seen in 21%, average was seen in 48% and poor knowledge was seen in 31%. The highest knowledge was for the question regarding the legal importance of informed written consent, and the lowest was for the question regarding the patient's right to withdraw the consent if required after signing it. Statistically significant relationships were found between knowledge level and education as well as knowledge level and age. Attitude results were promising as 81% showed good attitude and only 19% showed average attitude. The highest attitude level was for the question regarding the patient's responsibility to maintain decorum within the hospital, and the lowest attitude was for the patient reading through the patient responsibility guidelines given by the hospital. Statistically significant relationships were also found between attitude and education level as well as attitude and prior history of surgery. Practice levels were concerning as only 2% showed good practice patterns, 52% showed poor practice patterns and 46% showed average practice patterns. The highest practice pattern was for the question regarding the patient inquiring about the treatment options available with the doctor, and the lowest was for the patient reading through the rights and responsibilities displayed in the hospital. Statistically significant relationships were found between practice level and age, practice level and education, as well as practice level and history of surgery. As you can see in the scatter plot, there was a moderate positive correlation between knowledge and attitude, a strong positive correlation between knowledge and practice, as well as a strong positive correlation between attitude and practice. So in my study, the knowledge was found to be good in 21.2, average in 48.1 and poor in 31.2%, which was similar to the results obtained by Garima Kachava et al. 92.3% of our participants knew that informed consent was of legal importance, which was much better than the results obtained by Sanjay Marasani et al. It was concerning to note that 53.8% believed that they could not withdraw their consent after signing it, and similar results were obtained in the study conducted by Rajesh Dr et al. This study also showed a positive association between level of education and knowledge, as was seen in our study. Despite the average levels of knowledge, 80.8% of our participants showed a good attitude, and the results were much better than those obtained by Felix Ambonera et al. The same study by Felix Ambonera et al. Showed a positive correlation between knowledge and attitude similar to our study. And despite the average knowledge and good attitude in majority of our subjects, practice assessment results were concerning, as only 1.9% demonstrated good practice. This might be the reason for the increase in violence and unnecessary allegations against doctors, as highlighted by the 2015 survey by the Indian Medical Association, finding that 75% of doctors have faced some form of violence at work. So my suggestions include using visual aids, informative videos, simplified languages, and repeated explanations, as suggested by the work of Abrar Karan et al. As well as Anita and Shukla et al. Awareness programs can be conducted and medical legal aspects can be made a part of the curriculum for UGs and PGs with emphasis on practical applications. The limitations of my study include the study can be conducted with a larger sample size. It can be conducted among the general public as well as the medical staff to assess their awareness about this topic. To conclude, my study highlights the interconnected nature of knowledge, attitude, and practice in context of medical legal aspects of cataract surgery. Although Kerala boasts the highest literacy rate in India, despite having good knowledge and good average knowledge and good attitude in majority of our patients, the practice patterns were concerning as only 1.9% showed good practice. Our study also shows the influence of socio-demographic factors on this context, hence providing practical awareness regarding medical legal aspects at the grassroots levels is essential in bringing about a change in the society. These are my references. Thank you.
Old study, okay. What do you think will, if you start implementing in your hospital?
Yes.
What will happen to your practice in your hospital?
Sir, our practice has always remained the same.
No.
But
Now
it's
we have created this thing, one study. If you start implementing for every patient, every surgery patient, what will happen?
sir, I think as we saw in this, the knowledge was average
So
and
litigations will go against your hospital, numbers will go. You agree? You are creating an awareness. There is no
Yes, sir.
doubt about it. That is good. Actually, it's good to do that. But why did you say consents cannot be retrieved back, cannot be withdrawn?
no, it can be withdrawn. Like the patients were not aware that.
It's the patient's consent, no?
Yes,
Even
sir.
in the last minute after sign in, before time out, you know what is time out? Before putting the incision, he can walk out.
Yes,
He
sir.
can say that is there. Number 3, if you had done the study for doctors, no, regarding awareness of medical legal cases,
Yes,
I
sir.
would have given you 100 out of 100. Because the awareness of doctors is only bad, but this is also a very bold study.
Yes.
Second thing is what I would like to tell everybody. You are writing the words continuously like sentences and reading. Put bullets and talk. That will be more from the heart rather than reading. Good one.
Sir, one thing regarding the studies conducted among doctors, I searched the literature and previous studies have been conducted regarding the awareness among doctors, but among patients till now, especially in under ophthalmology, no study have been conducted.
Spite of all that, no, doctors
Yes, sir.
even do not know what is the grievous injury. Want to put AR entry. If it is already put AR anywhere, no, that's just lacking now, especially with NAB it's coming in. But that element, not that data. This is a new
Yes.
one. So we are increasing the awareness to increase it. 400% will become 800% the next decade. Definitely. Because if they know that I have had a complication, the lawyer will come and see me and say, you give me 50% of the claim, I don't give me any fees, I will work and get you money. That is what is happening now. Anyway, good.
Nice presentation, doctor. But
Thank you.
I think in future, I don't think doctors will practice. I think.
It's a good presentation and a different
you.
presentation. That's what we've been telling since yesterday. So it should not be regular, like we are seeing a lot of OCT and retina. So this is completely different. I appreciate.